So when we're talking about symptoms versus causes, I want to explain it in terms of maybe your experience. So what you feel, we call that a symptom. You get a headache, symptom. If you have ache in your knees and it's swollen, symptom. You're gaining weight, symptom. You check your blood pressure, it's going elevated, called hypertension, symptom. So in most people's experiences, they're educated to know the names and labels for all these different symptoms. And you go to the doctor and they say, hey, Mrs. Jones, you got hypertension. Now, a lot of times people will hear that and go, oh, they know what's wrong with me. They know what's going on. Why was I getting those headaches? Maybe the doctor said, well, you were sitting at 160 blood pressure and it's very common. You're going to have headaches with that. Oh, wow. It sounds like an answer to the problem, but really, what does hypertension mean? All it means in definition is you have abnormally high blood pressure levels. That diagnosis or that label on yourself does not explain why you have hypertension, what's causing the high blood pressure, what is driving up my blood pressure levels to where I cannot keep them in that good 120, 130 over 80 range. We experience a healthcare that is so symptom focused. All the names, or most of the names, are just describing the symptom and not the cause. So we go in, we get a diagnosis, and there's a drug for every symptom, right? We have to be diagnosed for the doctor to give you the drug. Now, that is very different than root cause, where we start asking, why do you have the diagnosis? Why do you have that medication for high blood sugars or blood pressure or cholesterol, or sometimes they're taking drugs for weight gain, why you can't sleep? That question right there, why is this happening, is so important that everyone ask that, because it's going to lead you down a different path to find causes. So, for example, we don't feel the breakdowns in our liver and the dysfunction and bile acid getting gunked up and everything like that. We don't really feel that most of the time. What we are going to feel is once our gallbladder gets skunked up, we have gallstones, we have a gallstone attack, we run to the doctor, oh my goodness, gallstone attack, let's cut out the gallbladder. So we didn't really feel that whole development, which might have taken months to years to develop. We don't often even feel our blood pressure going high. Many diabetics, I'd say most diabetics I talked to, did not really feel anything all the way up until the day they were diagnosed. And sometimes they've been diabetic for 10 years and still don't really have symptoms. We call it asymptomatic or silent diabetes for that matter. So I want to share that so people can start separating out symptom, which is what they're experiencing, how your body talks to you, your body's warning signs to let you know something's not right. These are symptoms versus causes. And that's where the real solutions lie. Once we solve the underlying problem here, it typically clears up the effect, the symptom, right? If you have a check engine light pop up on your car, we can't just cover over the light and call it a day. Someone's got to pop the hood, understand why the light came on, fix the engine, and then once you fix the engine, the check engine light turns off. So that's a simple analogy, if you break it down, is not really happening for most chronic disease management in the medical system. It is they need one number, A1C, to tell you it's high blood sugars. That number, once it's over 6.4, they can label you type 2 diabetic. No other investigation needs to be done to give you your first blood sugar medication. You give blood sugar medication, and now the story just continues like that, typically for the rest of your life, unless some other emergencies or crises come up that warrant them to then do some deeper analysis. But at the end of the day, for most diabetics, you're diagnosed, you get high blood sugar symptom, you take the symptom med, it lowers the symptom, and their job is done. I'm not saying that that's not necessary or that's all bad. What I am saying is Once they do that and they have stabilized you with a medication, the problem is that most people stop there and that's it for their health care at that moment. Take the drug, I'm back to my life. And all I ask people is once you're diagnosed and you're taking the medication to get stable so nothing dangerous happens, please, please, please shift over to start asking why, what caused this? Was it because of my lifestyle and my habits and my diet? Or is there something else going on inside where something's dysfunctional? Maybe the liver's not happy, your gut's not happy, your thyroid, your hormones that are causing an issue with your blood sugar levels. See, that's where I come in and we do some functional health testing, some more dynamic and comprehensive look at the body to understand what's causing these blood sugar imbalances as opposed to I'm just testing you to see where you're at and I can medicate you. That's a big question a lot of people have. Why is your testing any different than my doctor's blood work that I just got done? So you see, those are very limited because they're just making sure nothing emergent is happening. And a lot of those tests, if you've already been prescribed, are to be checkups to regulate your medication properly. So I'm not testing you to medicate you. I'm testing you to understand why are you being medicated. And that is a big difference on approach and a big difference in understanding about how we help and treat and manage and ultimately in my world help people reverse this condition.